Last week, the Biden administration announced it would require nursing home employees to be fully vaccinated against COVID-19. If nursing homes do not comply, they risk losing access to Medicaid and Medicare funds.
So let's bring in now Mark Parkinson, the president and CEO of the American Healthcare Association and National Center for Assisted Living. Mark, thank you for being back on the program. So tell me, how are the nursing home, the workers taking this mandate? What's the response been?
Well, I mean, let's start out with the really good news. The really good news is that over 80% of residents of nursing homes are vaccinated. Over 62% of staff are vaccinated. And I think that's the reason why case counts for COVID are really pretty low in nursing homes. The challenge with the mandate is what you talked about earlier. We've been singled out. We think the administration hasn't gone far enough, that it makes much more sense to mandate it for all healthcare workers, hospitals, home health, nursing homes, everybody. Because the problem is if you just single out one segment of the provider group, we've got a bunch of folks that are very vaccine hesitant, and we're afraid they're just going to end up working for hospitals and home health and leave the residents that need the care without enough workers. So there's real concern in our sector, primarily because we've been singled out.
Well, and there's already been a problem even before this pandemic with staffing shortages at nursing homes. In fact, your organization conducted a survey showing 73% of nursing homes say their staffing situations have even gotten worse since 2020. So what are your concerns about what this mandate might do to an already depleted workforce?
Well, it's a major problem. As I said before, about 38% of our workers have not been vaccinated. That's about 500,000 people. We think that about half of them will leave to go work for hospitals or home health agencies where they don't need to be vaccinated. We think that we could lose tens of thousands, maybe hundreds of thousands of employees. So we really encourage the administration to mandate it for all healthcare providers, and then also for folks that are in nursing homes, give us a little bit more time to work with the staff. We understand the need for everybody to get a vaccine. We've increased the rates from 37% to 62%, but we need a little more time. And while we're taking that time, we think that we should, have daily testing of them to make sure that they don't have COVID. But if just overnight we have a mandate and they're fired if they don't get the vaccine, there's just not going to be enough workers to take care of the residents in our buildings.
Well, here we are that the vaccine's been out there. I know the official word came in the approval of Pfizer at least, but what else do you need to say to these healthcare workers? You say you want to convince them, you need time, but given that we're talking about nursing homes and a very vulnerable population, isn't this a good place for the administration to start at least?
Well, we think, again, the administration should do it for all healthcare providers, so there's going to be a mass exodus of workers from our buildings, and we completely agree. Everybody needs to take the vaccine, everybody in the general population and everybody that works in these facilities. But there is a massive amount of misinformation out there on the internet, which is confusing, particularly the young women that work in our buildings. There are some very crazy reasons that people don't take the vaccine, and those are not understandable at all. But there are some legitimate concerns that some of our employees have about fertility, the ability of them to have children in the future. There's so much misinformation on the internet about it. It's all wrong. We know that the vaccine is safe and does not impact fertility. But these are real concerns that need to be addressed in an intelligent and thoughtful way. And we just think that laying down a hammer and perhaps as early as a month from now, forcing all these people to leave their jobs is not the way to do it.
Mark, I know you've asked the Department of Health and Human Services to release funding, in fact, $13 billion to be specific. You want that dedicated to long-term care providers. Why do you need those funds? What would it mean to your industry?
Well, we're continuing to fight COVID. As everybody now knows, it's a massive problem out in the general population. We've got to work really hard to keep it out of our buildings. That involves all sorts of extra expenses for testing, for personal protective equipment, for trying to get additional workers in the buildings. The buildings are running out of funds. In order for them to continue the fight for the residents against COVID, they need some additional money. This administration has not yet paid any money out of the Provider Relief Fund. There's still $43 billion in there, and we encourage them to open up the portal and make those payments very quickly.
Well, Mark Parkinson, we know that you are dealing with a lot on many fronts, so we appreciate your time today. Thank you for being a part of the program.
Thank you very much.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here. to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.